Now, the federal government says it is finalizing a draft policy that will channel excise tax revenues from alcohol, tobacco and sugary drinks into health financing. With the current tobacco tax regime ending in May 2025, stakeholders are calling for higher tobacco taxes to increase revenue and strengthen public health. To report.
Nigeria sells over 18 billion cigarettes every year, costing citizens an estimated $931 million. The World Health Organization has warned of poor health financing and the rising burden of non-communicable diseases linked to tobacco, alcohol, salt, and sugary drinks. Experts and stakeholders argue that raising tobacco excise taxes would cut affordability, reduce consumption, boost government revenue, and recover over 526 billion naira lost to tobacco-related costs.
Our objectives is to see how we can support governments to come up with taxes that will first discourage consumption of tobacco in Nigeria, given the health consequences of the consumption of tobacco. Our young boys and girls are consuming this dangerous substance, which they mix it with all sorts of dangerous drugs inside. It's not just the cigarette.
Unfortunately, the situation in Nigeria is that excise taxes on tobacco products are incredibly low. They are much lower than international benchmarks. They are much lower than the ECOWAS directive, which indicates that for each pack of cigarettes there needs to be at least 50% excise tax, together with a specific tax of 40 US dollar cents per packet. Excise taxes in Nigeria are currently at 30% of the so-called ex-works value, and only 104 naira per pack of cigarettes. That is very, very low in an international context.
Critics have often argued that higher tobacco taxes could lead to job losses in the industry, but tax expert John Twomey clarifies such fears as unfounded.
So the argument that has always been put forward by the tobacco industry, that when taxes are increased, there are people who will lose their work or jobs because of either the industry shutting down or uptake of these products will reduce. So from our perspective, and research has also proven this, is that this is not true. It is just a fallacy to instill fear to the people, to the administration, and also to mislead the general public. The mere fact that taxes, when increased, consumption of tobacco products will definitely reduce. And therefore, we will have a healthy society, a healthy public, and the money or the funds that they were using in terms of buying tobacco products, consuming, and losing in terms of their health, they will be able to invest in other quarters.
Trust TV also spoke to residents of the Federal Capital Territory to get their views on whether the government should raise taxes on tobacco and alcohol.
This is very, very good suggestion, because our people are dying because of cigarettes.
I mean, I take cigarettes, I take tobacco a lot, but it just doesn't stop me to do anything I'm doing. If it's 1,000 naira, if it's 10,000, I'll still buy it.
Well, as for me, my own opinion, I think government is in the right direction at the right time. Increase the tobacco is very good to discourage the underage from taking alcohol.
Tobacco remains a major public health challenge as it causes cancers, heart disease, lung illnesses, and pregnancy complications, while secondhand smokers endangers non-smokers. Economically, it drains health care budgets, reduces productivity, and burdens households, while socially, it fuels addiction, harms young people, and damages the environment, making it one of the world's leading preventable killers. Noel Samson, Trust TV News, Abuja.